The intent of tonight is to talk about a kind of PPE on the ground here in London. Give you guys some ideas about things that we've been working on. The genesis for tonight's talk was that I found that we've had this kind of same conversation with a lot of physicians over the last couple of weeks. So we thought, let's do a webinar. Let's have these conversations recorded, and we can get the message out there. So we'll go next slide. If we can, perfect. So disclosure. So as you guys probably know, I have no specific expertise in public health or infectious disease. No official endorsement from any official body at this talk. This is essentially my experience with PPE over the last few weeks, my reading on the guidelines from above, and how we can incorporate that into our practices. So essentially, it's to give some ideas and some feedback for you guys in your practices. So next slide. So first thing to know, and a lot of you know this already, but if you need help with PPE, so if you have a critical supply in your office of any of the four main components, first person to contact should be Janet Dang. Her email's right there. I know a lot of you have already reached out to her. If you need help with office logistics, for instance, we're going to talk about our setup in our office with our little drive-through that we've set up. If you're in a setup at the third level of a building, or you don't have a back door, if you need help with office logistics, Cecilia Dosber is a OT with the Thames Valley Family Health Team. They've been kind enough to loan her for periods of time to any family docs in town who need help with, again, the logistics of setting up essentially what's a different world for us, right? Seeing patients with potential infectious disease. We may want to distance from others in the office, so she can help with that. And if you just want some advice from a fellow family doc, you guys can always email me. There's my email there. Some of you have my phone number, but again, email's available. Next slide. So agenda, so we're going to go through what the components of PPE we need in our offices, how to use them properly, some ideas for disposal and reuse, and we'll do a Q&A at the end. And please, as we go along, don't hesitate to ask some questions in the chat, and we'll answer those at the end. Next slide. So before we talk about PPE, we want to remind everybody, and I know a lot of you who are on this tonight have already signed up, but there's the COVID19 Navigator that is being promoted to the public as essentially a patient-facing triaging tool. The intent of it, there's a few intents, but the big sell for family docs is that patients with mild symptoms who are putting their own symptoms in the questionnaire, who don't even need an assessment, are essentially taken by the triaging tool and reassured, self-isolated, given specific guidance, so they're not even coming to your attention. Because I know a lot of us are busy, so it's a nice way to get some of those patients decanted. Also gives population level data, which is shared with public health, to give them a sense of actually what's going on in the community. Right now, obviously, with limited testing, there's some question as to whether they're getting a fulsome picture of what's going on. So this kind of program can give us some data to that. And it's an easy system for reporting probable cases to public health. At the end of the tool, when you put everything in, there's a very easy process there for reporting to public health, which we should be doing for probable cases. So there's the link there to now to sign up. You guys have gotten probably a lot of emails about this. Gord, I'll let Gord chime in at the end with any other feedback. But check your emails. There's been lots of push for signups. So Dorley just asked, how do patients get into that system? They go to that website there, and that gives them two options: patient or staff. They click patient, and that takes them through the sequence of questions. Depending on whether their physician is signed up or not, it'll take them through a different process. We can talk about that a bit at the end with the Q&A. Okay. Next slide. So as you guys know, when seeing any patient with probable COVID, the current guidelines are for droplet precautions. So that is eye protection, gloves, surgical mask for non-aerosolizing procedures, and a gown, okay? And again, it's a bit of a different world, right? When we look at family medicine and what most of us had in our office as spares, some who had a pre-existing SARS kit may have had a lot of this stuff lying around, and obviously we had gloves and some of us had a few masks, but largely there's been huge gaps in terms of how many docs had adequate eye protection. How many had gowns? So I know thanks to Janet's help and a lot of the community involvement that we've had with people donating huge amounts of stuff, we've been able to get a lot of equipment out to you guys and a lot of the family docs because again, this is a very different world we're living in than 2 weeks ago. So there's your drop of precautions. 4 components to keep it easy. Next slide. We'll talk about each of them. So donning and doffing, what we found helpful in our office is actually printing out this handout. It's a 2-page handout, donning and doffing on 2 separate pages, and any place in the office where you're having staff, docs, taking stuff on, putting stuff on, plastering to the wall. We don't work in hospitals. This is not something that we often will have to remember the order of things. So having these printed in areas where you're going to be using them is super helpful. We found that very helpful in our office. So there's the link there through the CDC. If you just Google CDC PPE donning doffing, that's the PDF that comes up. Yeah, it's very simple and have it prominent in your office. Next slide. So masks. Obviously, there's a bunch of controversies around this in the last few days with what we recommended to the public to wear. So that's a separate side. We're not going to get into that tonight. But the guidelines around what healthcare professionals should be wearing are fairly clear. And despite some smaller studies you're seeing here and there with whether it's aerosolized or not, you have to take those with a grain of salt for reasons we won't get into tonight. But the most important thing is you have an adequate supply of surgical or procedural masks. If again you're short, reach out to Janet. We do have a fairly good supply, I believe, of those still. Now, N95 should be used for any aerosolizing procedures, which in family medicine we're really not doing much. I would be shocked if anybody did anything close to that. So again, surgical masks are considered sufficient. Now, in terms of how we can kind of reuse and make the most of those, this is up to physician discretion. So a lot of what I'll be saying today is again, opinion. You have to use your own clinical judgment, and I'm not telling you to take risks that you see as unreasonable. But what I've been doing personally in the office is I'm wearing the same surgical mask all day long, unless I'm getting it soiled. If it's becoming harder to breathe through it, that would be a reason to change it out as well. If it gets visibly dirty, those would be reasons to change it out. But in our office, we're trying to be as judicious as possible with masks. I know it's, again, a different world than even 3 weeks ago where kind of 1 mask per use. Again, use your clinical judgment. I don't want you to do anything that you feel uncomfortable doing. And that's the whole reason we're doing this, right? We want to make sure, the whole reason this all got started is that we want family physicians to feel protected enough that they can still keep seeing patients and can keep their offices open to patients who actually need to be seen. 99% of our visits we've obviously made virtual. But for those who need to be seen, we want to be keeping people out of emerge because of the likely spike we're going to see over the next week or two. Okay, so we're using those masks again. For those using N95s for whatever reason, there is an interesting study out of Stanford. There is the link there. They essentially took N95s, baked them at 70 degrees Celsius, so it's 170 Fahrenheit, for 30 minutes, and found that did actually kill most of the 99% of the microorganisms. It also looked at heated water vapor as well as an effective means. Now that wasn't studied in surgical masks. That's the one thing I've been telling people very clearly is that we don't know whether it degrades surgical masks to the same degree. Studies haven't been done on that, so we can't comment on that right now. Next slide. So for gowns, so when we started, in our office, we had short sleeve gowns. So we were, those of you who saw my video where I showed our office setup, we were using short sleeve gowns and washing our arms, and obviously that wasn't best practice at the time. So what we've done is we've reached out to Lens Mills store, and they've been kind enough to donate a ton of fabric. They actually designed the pattern to make these cloth gowns. The pattern was based on the ICU and endoscopy gowns from LHSC. I managed to snag one of those. Lens Mills took that. They made a pattern, which is available on our website, londonlambeth.ca. They gave us a ton of fabric, a ton of kits, and local volunteers have been sewing hundreds. By the end of the week, we should have around 500 gowns made. These are polyester cotton gowns. So the tighter the weave, the better it is in terms of keeping stuff out. We've kind of ended our agreement with Lens Mills at this point because we can't keep this going indefinitely. But they've said that moving forward, if someone wants the kit, so the fabric cut out into the pattern, they'd sell it for about $15 and $25 for a completed gown. So if you're interested, reach out to Janet. If she doesn't already, I'll give her the contact for Lens Mills. They want to be contacted directly because they're barely answering any phone calls. So if anybody is interested in that beyond the 500, again, if you need cloth gowns now, reach out to Janet because we're going to be giving her a ton within the next week that we've got so far. Okay. Now the question is for laundering services, because some of us have laundry in our facility, some of us don't, and it's generally not considered the greatest practice to be bringing gowns home. Again, it's in your discretion, but what we want to try to do, if possible, is be using kind of commercial laundering services. For those who don't have laundering services, laundry in your office, I would encourage you to reach out to Janet. We're going to compile a list of everyone who's interested and see what London Hospital Linen Services can arrange in terms of courier and frequency of pickup and all those things. We don't know what numbers are yet. We don't know really how many are going to be interested, so we haven't made anything official. But if you are interested, let her know, and we can start putting some things together. Next slide. Eye protection. So this one's been kind of innovative. A lot of you may have seen in the news with Tarek Lubani, who's an Emerge physician, and he 3D printed part of the eye shield. So that's in the first and second picture there. I've actually gotten a friend of mine to 3D print some of those based on Tarek's link. The link is right there to take you to the so if someone has a 3D printer, they know what they're doing. That's the link. It'll take them all the instructions, and they'll often have the materials. And for that shield, all we did was take an overhead projector slide from Staples. We got some from that, and we slid it in, so now we've got a full face mask. Okay. The other option, you can see the third picture there. So our office has probably a couple hundred of just the lenses. So not the full face mask, but just the lenses. But we didn't have enough frames. So again, I had a friend 3D print a couple hundred of the frames. So we'll be giving a few of those to Janet as well. I know Janet got a huge shipment today, as I saw on Twitter, from sorry, I can't see his name in my slides. Lee Smithson, I think, from Western Engineering. They've been making a ton of face masks as well, which are available. So again, eye protection should not be a concern through all of this. I know, again, the nitpicking around N95 versus surgical masks, you got a full face shield, really minimizes that risk. Again, these should be cleaned between use, right? There's no reason to be disposing these after use, which is maybe what we would have done previously with some of the shields. We'll talk a bit about cleaning at the end, but we want to be as sustainable a process because this will be going for months, right? We want to make sure our equipment lasts as long as we need. Next slide. And lastly, gloves, very simply, easily available. I have yet to hear about anybody with glove shortages. If you have an issue, reach out to Janet, and she'll talk to you. The question I'll answer the question right now about cloth gowns not being soil protected. Shouldn't it be waterproof? So this becomes a practical thing, right? The types of exposure that will be in family medicine, right? We're not near an ICU. We're not near a ventilator. We're not near anywhere where there's going to be a huge amount of particles coming our way. Interestingly, there was a study done at Singapore where they took the room of a patient who was COVID positive, and they swabbed the whole thing to see where viral particles were hanging out, and they were just about everywhere in the room. But interestingly enough, one of the few places they were was actually on the physician's gown, what was on the staff's gown coming in and out. So given how low risk it is, again, most of us, whatever clothes we're wearing, we're not trucking to our house too. So the odds of that being a vector for making either ourselves sick or another patient sick, I think would be fairly low. Again, you have to use your own clinical discretion. I don't want you guys doing anything you're uncomfortable with, but that's just the approach that we've taken in our office, is that second layer, scrubs, and then the polyester cloth gown, we've considered sufficient. Next slide. So some of you have seen this. So this is our office setup. This is on the side of our office. We've set this up for seeing patients in our little outside. Anybody with any respiratory symptoms, again, travel history is less of a thing now. But anyone we didn't want to bring to our main office, we're seeing out the side here. So from left to right, we've got a bin just for cloth gowns. We've got an actual garbage. Lid is always open, except for in this picture, obviously. Then we've got a clean rack there with gloves, our cleaner, our gowns, our eye shields. And then next slide, I'll show you the trays we have. So we found this setup in trays to be useful. So we've got 3 trays set up, 2 for clean instruments and then 1 for dirty instruments. So essentially what we do is when we go out to see the patient, door is open, we're not touching the door at all. We're taking one of the clean instruments, we're using it, we're putting it on the dirty instrument tray, okay? This was between uses. So actually that clean instrument number 2 tray is typically totally empty as well, okay? So what happens is you put it on the dirty instrument tray. Once you're done, the clean instrument 2 tray is totally clean. A staff member with a mask and gloves goes to the dirty instrument tray, cleans everything one by one, leaves it on the clean instrument 2 tray to dry. Should dry for, depending on the product, we're using a hydrogen peroxide product that needs to sit for 3 minutes. But depending on your product, you're going to leave it there. Once it's dry, staff can then put it on the other clean instrument tray. So it's really important for staff to kind of know this process in terms of where the dirty instruments are, where the clean stuff is, and kind of what the flow is there. Next slide. And then for cleaning equipment, again, you guys are going to have your own products that you've been using, whether it's Cavicide. Again, these are the hydrogen peroxide wipes we have. There's a link there that I've included on the slides to a whole bunch of cleaning products that can be used. Again, it totally depends on what you're using. I know Janet has given out some products as well to some of you. So just check the product monograph for how to be using those. Next slide. Okay, yeah, nice and quick. So we've got time for questions. Again, the intent was, if you guys have questions for us, I wanted to show you kind of